Hey guys, welcome back to my channel. This is Dr. Prasanjit Das and you are watching Prasu'S Medledge series. I hope you all are doing great and have watched my previous videos. If not, what are you waiting for? Go for those after the end of this video. Now without wasting any time further, let's get into today's topic. So today's topic is lung abscess. So lung abscess is basically defined as a circumscribed necrotic area of lung parenchyma containing purulent material, that is pus. So this is basically the definition of lung abscess. Now coming to the etiology of lung abscess. The important causative factors includes the following. First is aspiration of the nasopharyngeal or oropharyngeal contents. This is the most common cause for lung abscess. Coming to the factors which are favoring this aspiration, it includes depression of the cuff reflex, then carcinoma of esophagus and gastroesophageal reflux disease. The lung abscess, which is formed due to aspiration of this oropharyngeal or nasopharyngeal content, is called as aspiration abscess. That is aspiration lung abscess. Coming to the other causative factors, next etiological factor is pulmonary tuberculosis. Then next is bacteremia. It causes lung abscess by hematogenous spread of infection. Then we have secondary infection of a cavitatory malignancy, which also leads to formation of lung abscess. Coming to the clinical features of lung abscess, it includes symptoms and signs. So first is symptoms. Okay, so lung abscess have basically two modes of presentation, that is acute and chronic. Acute means symptoms will be present for less than 1 month, and chronic means symptoms will be present for more than 1 month. So in acute presentation, patient presents with high grade fever, chills and rigors, chest pain and dry cough. But when the abscess cavity, that is abscess, ruptures into a patent bronchus, okay, ruptures into a patent bronchus, then the patient starts expectorating large quantities of purulent, foul-smelling sputum. Okay, so initially the patient will present with dry cough, but when rupture of lung abscess occurs into a patent bronchus, then patient will start expectorating large quantities of purulent, foul-smelling sputum. Now coming to the chronic presentation, patient has insidious onset of low-grade fever here, then cough, malaise, chest discomfort and anorexia, that is loss of appetite for food, and sputum will be also produced, which is putrid again, that is foul smelling. Now coming to the signs, first is on general examination we can see pallor, finger clubbing, fever, halitosis. That is, halitosis is basically bad breath, that is an unpleasant odor coming in the exhaled air. Next is respiratory system examination findings. It includes dullness on percussion, okay, then increased vocal fremitus and vocal resonance, bronchial breathing crepitations. These all features are seen in the later stage of disease. Initially the patient will not have any respiratory system examination findings. Coming to the investigations which we need to do in case of a patient of lung abscess, first is complete blood count, which will reveal anemia and leukocytosis. Then ESR will be elevated. Then we have to do sputum studies, that is, it includes Gram staining, Ziehl-Neelsen staining, culture and sensitivity. Then next investigation to be done is chest radiograph, which will show area of lucency, that is black area, in an opaque area of consolidation. So consolidation will appear as white on the chest x-ray, and within that area there will be a black area which will signify a lung abscess. Then we can do CT scan of thorax, which can detect the lung abscess definitely. Coming to the complications of lung abscess, first is hemoptysis, then we have pleural effusion, then we have empyema, then we have pyoneumothorax, that is basically presence of air and pus both within the pleural cavity. Okay, empyema means just collection of pus within the pleural cavity, and pleural effusion means collection of fluid within the pleural cavity, but it is not pus. Then we have bronchopleural fistula, then we have aspergilloma, which is nothing but a fungal ball, and residual fibrosis. So these are the complications of lung abscess. Coming to the management of lung abscess, first is postural drainage and chest physiotherapy. These two plays the main role. Then we give antibiotic therapy based on the sensitivity reports. But most of the patients with lung abscess will respond to oral treatment with amoxicillin clavulanic acid, that is 625 mg TID, that is thrice a day. In case of anaerobic infection, oral metronidazole, that is 400 mg, needs to be added along with these. If the patient of lung abscess is very ill, then in that case we won't give oral antibiotics, we will shift to parenteral antibiotics. In cases of large lung abscesses, we have to do percutaneous aspiration and placement of a pigtail catheter because these play a major role in the management of large lung abscesses. So this was about lung abscess. I hope you understood the topic. If you like my content, please do like, share, subscribe, comment, and also press the bell icon to get notified whenever I upload a new video. Thank you guys.